When you hear the term holistic health, your mind may go directly to alternative medicine, naturopath, or other complementary therapies, which is different from holistic health from a First Nation Inuit Métis perspective. The model of holistic health and well-being focuses on wellness and prevention, rather than simply treating diseases or diagnoses. It's a more comprehensive, cultural, and personalized way of thinking about wellness. The model of holistic health and well-being is an approach to wellness that simultaneously addresses the physical, mental, emotional, and spiritual components of one's health, and defines well-being more than merely physical health or the absence of disease. The model is rooted in the understanding that all aspects of self impact overall health, and being unwell in one area may affect other elements of health. The model recognizes that the body, mind, and spirit are integrated in a coherent whole. When looking at the model of holistic health and well-being, you may notice that it's divided into 4 quadrants. Each quadrant offers lessons and gifts that support the development of a balanced self. The idea is to remain balanced at the center of the wheel while developing equally the mental, physical, emotional, and spiritual aspects of one's health. The 4 directions of the model of holistic health and well-being begin in the East, representing new life. Starting the life cycle in the East is babies and children. They bring the teachings of joy, love, and happiness to their families. This is a time for bonding, learning, and nurturing during the child's formative years. The life cycle begins in the East, as is the Eastern doorway that represents birth and new beginnings. Moving into the South are the youth and young adults, who bring the teachings of understanding and enthusiasm for life. This is a time to make choices among the many paths in search for meaning and clarity. The South represents the growth youth and young adults experience throughout this life cycle. The West represents adulthood. Adults bring the teachings of love, hope, and nurturance. They have the responsibility to provide for their children, themselves, and their extended families, in hopes to live a good life. As role models, they make clear the vision for future generations. This is a time for looking into one's spirit, a time to think about their influence on others, such as children, youth, and young adults. Lastly, in the North, elders bring the teachings of wisdom and spiritual understanding in their roles as healers and keepers of teachings and ceremonies. The North represents spiritual strength, goodness, and wisdom. It is here where the journey around the life cycle has come full circle, and it is a time where the physical journey on Earth ends as the spirit travels back to the spirit world. Culture as healing reconnects people to the vibrancy and strengths of their culture, and in doing so, enhances health and wellness. Culture is a part of all aspects of life and is essential to the overall well-being of First Nation, Inuit, and Métis communities. It encompasses more than treating symptoms, enabling clients to be holistically well longer. Making culture as healing more accessible can help communities heal from historical trauma. There is cumulative emotional and psychological wounding over the lifespan and across generations, emanating from massive group trauma. This contributes to poor mental and physical health. Thus, culture as healing needs to be at the center of all healing practices. Studies have consistently shown that introducing culture into healing is a strong protective factor for First Nation, Inuit, and Métis. Looking at tangible actions to increase the model of holistic health and well-being within public health practice, it's important to do so in collaboration with your local Indigenous organizations. These may include Indigenous primary health care organizations, local First Nations, friendship centers, Métis Nation of Ontario chapters, Inuit associations, or other urban Indigenous agencies. This is a critical step towards ensuring that programs and services that align with the model of holistic health and well-being are culturally appropriate and safe. Some areas to explore with your local First Nation partners may include, starting in the East, looking at emotional healing and belonging. One opportunity is the development of referral pathways that could connect self-identified Indigenous clients with appropriate cultural services. An example being a referral of Indigenous families to the Métis Healthy Babies, Healthy Children's program. This program complements the mainstream HBHC program by incorporating culture and ensuring equitable access to resources, support, and knowledge for Indigenous communities so that their children have the best possible opportunity to thrive. In the southern direction, we focus on learning, language, and mental well-being. A tangible action for public health practitioners is the completion of Indigenous cultural safety training to support your learning journey on learning about the history of Indigenous peoples in Canada. Other examples include providing mental wellness supports that extend beyond what is usually offered to clients, to include traditional healers, ceremony, language, and so forth. And of course, this would be led by your local Indigenous partner. Moving along the wheel to the west, we focus on physical well-being, teaching and interdependence. And here's where you can formalize and codify how the public health programming will blend mainstream and traditional Indigenous models of care together. You can take a two-eyed seeing approach to service delivery, similar to what was previously described to with the Métis Healthy Babies, Healthy Children program. Or you could look at establishing a collaboration with a local Indigenous primary healthcare organization to co-deliver a vaccine clinic. This would ensure that both elements of mainstream and traditional practices are included. Finishing in the northern direction, this quadrant holds spiritual, reclamation, and generosity as core values. This is where many of us can take our first steps to implementing the model of holistic health and well-being into our practices. This can be started by improving our relationships with both Indigenous and non-Indigenous partners. We can consider strategic ways to ensure that both voices are heard and considered at the tables and have equal decision-making power. One step towards achieving this could be the establishment of relationship agreements, ensuring that the agreement is mutually beneficial and supports Indigenous health and Indigenous hands. As you continue to work towards creating safer and more culturally appropriate spaces for First Nation, Inuit, and Métis clients, it's important to be aware that not all Indigenous people are going to want cultural services or be in the same phase of their cultural reclamation journey. Some may be searching for their identity. Others may just be learning of their identity due to colonization, oppression, and other reasons. Whereas others may never have had access to traditional healing or cultural practices. So this would be a new avenue for them as well. But it is important to have a general understanding of culture as healing and the model of holistic health and well-being to begin creating a culturally safer public health environment for First Nation, Inuit, and Métis clients.